Hi, good morning. This is Linda Bersosa, and I've been here in Canada for 25 years.
And I'm the manager of the Newcomers and Families program here at South Riverdale Community Health Center.
My name is Andrew Omurangi, and I work at South Riverdale Community Health Center as a client care.
So hi, my name is Dr. Paul Culford. I'm a family doctor in Scarborough for about 35 years.
My name is Zara, and I'm from Iran.
Senior friends, I belong to an organization called the currently Filipino-Canadian Seniors Club, and most of our members are in their 80s and 90s, and they're having health concern. And what is happening is, one, I think we lack doctors, and the hospitals are short of nurses, and so when we go to our family doctor, we have to have a long wait. And sometimes, because we have our rides coming in, like me, I'm a wheel trans rider, so I'm always waiting on a long line, so I'm missing my appointment. And then afterwards, my family doctors got sick, and now it's almost for 3 months now. We don't have any family doctor, and I'm looking for one for my co-senior members. That we are about 20 that doesn't have any family doctors now. And also 2, 3 is now in the nursing home, and they were saying it was really bad. And 1 is in the rehab, it's the same story. And then 1 or 2, they had their surgery. And amazing, and I really cannot understand it, why it is a major operation and then you can stay in the hospital. So I think this is an effect of those
some of the huge challenges that new immigrants face when they come into the country. We know that there is this 3-month waiting period, and really very limited options available to them. Community health centers do provide services for them, but that is all that is really available. And I just want to kind of share a story of a new immigrant, a lady from Bangladesh who came in, and she was in her final trimester. She was pregnant, I think, 27 weeks, and had nowhere to go, and she was given the runaround in terms of, she went from one place to the other. Nobody could kind of support her, guide her, and there was this huge, fear of how much she would have to pay when she went into hospital for her delivery. And luckily, she was directed to a health center where we have a program for women who come in so late in their pregnancy. But again, it is not available through most community health centers. And so the question is, we were able to help this one woman, but she was saying that before she came in, there was so much of stress.
This lady went to hospital eventually after 2 days of the trial to take her to hospital. She went because she was highly anemic. She went at about 2 p.m. on a Thursday, but then only got a bed she got admitted and given a bed at about 3 a.m. the following morning. That was an extended time for her to wait. And when the doctor finally saw her at about 11 a.m., she was found to be highly anemic, and she was given a transfusion, about 3 pints of blood and a drip. And then the doctor noticed that the foot was actually very badly infected. He decided to operate it right there and then on the bed. He could not take her to hospital, to theater, because it would have taken them a bit more time to get that ready. There are many patients and limited resources. This patient eventually got discharged 2 days ago. She at the moment is at home, and she needs a cane. She cannot be able to afford that. We are struggling to get a cane for her. The hospital would have loved to give her one through one of their services, but wasn't able to afford it. Now, the lady cannot move. She cannot help herself at home. She cannot access home care because of the challenges that are involved in accessing the care. she was told that she can only access this after at least 4 weeks to 5 weeks. Her condition is very dire, and this is just one example of the many patients that we deal with.
We had one lady from Nigeria who came to Canada because her daughter was being threatened with female genital mutilation, and she had lost a daughter to FGM who bled out in Nigeria and died, exsanguinated, bled to death at the age of 3. And she wasn't going to put this other daughter through this, so she bundled up her child and came here, and she was 39 weeks pregnant when she arrived. And the people at the crossing at the entry point said, don't apply now, apply in Canada. She was then delayed 6 weeks. She delivered her baby a week later at 39 weeks. She didn't plan to come here to have a baby. This wasn't medical tourism. She was saving her other child's life. And as a result of that, she has over a $5,000 bill now for this baby because she didn't have IFH. And the child was born here, the infant was born here, and again, because she didn't have her IFH papers, even though there's a right to OHIP for every child born in Ontario, because she didn't have her IFH papers, hospital and other officials refused to give her what she needed to get OHIP for the baby. So for the first 6 weeks, the baby was also medically uncovered. So we have an infant born in Canada without any medical coverage.
Because for all the services, we have to go for waiting list, and we were losing time at that time. So I was a single mom. I didn't have any job. I was devastated with all the responsibilities and all the hard time that she gave me with sleeping disorder, eating disorder. It was unbelievably difficult, and there was no support. There was no service for her. So what I did, I started to spend all my money to get private services for her. Now she's been on the wait list for IPI. It's more than 2.5 years. She's high function, and I don't want her to be locked in her own world. That's why I don't buy clothes. I don't spend money. I just save money for her therapy, which is very expensive. We just got one block of speech, and it was last year only for 6 weeks. Now I have to pay $140 for speech, and it's weekly, and I have to pay for that. For ABA therapy, 1 hour is $40. I don't have money. I really don't have money, and I don't know what to do. So if there was services available for her, she could grow up by when she's teenager. Of course, you know, she could be positive, like she could be educated, be someone like a normal kid, like my other daughter. But now there is not services, and what I do, that I just have to, I can't spend that much time with her because I'm going to school. I want to earn money to support her, and all the waiting list for everything is too long. And but in Iran, as I mentioned, there wasn't that much support. But last summer I went over there, and there was free school for those children, and I got services for her. So I don't know, like it's some mixed messages, and we really need funding, and we really, especially in those areas that there is waiting list, we need support from our government.
Something you said prompted me to get in line. Excuse me. I represent the dinosaurs. We're the aging parents. We're the pioneers of Bill 82 and keep your disabled kids at home. Every step of the way, we have had to fight, and we're still fighting. My son is 44 years old. He's a hemiplegic and a partial quadriplegic. We get 3 hours of support. 3 hours. Somebody comes in and helps him shower 2 days a week. I am only one of many, many, many aging parents. We're tired. We can't do this much longer. And if we have to get on a bus and go to Queen's Park, this provincial government is going to keep its promises.